Assalamu alaikum warahmatullah. I hope you're all well. In this video, I'll be discussing about an important exam that is used as a part of selection criteria to allocate thousands of training slots across 13 specialty programs in United Kingdom. I'll be talking about MSRA exam. What is MSRA exam? What is format? How many rounds it is conducted? Its booking, eligibility criteria, crest form, its preparation, scoring, and exam techniques. So before going into detail of this video, last day to apply for this exam is 21st November 2024, 11 days left. If you are an international doctor, you should apply for this exam if you are eligible for that. And keep in mind that this video will be helpful for you. The detailed videos have been uploaded on my YouTube. So coming on back to the what is MSRA, it is a multi-specialist recruitment assessment, which is a computer-based assessment at intern level, at foundation level, that you can remotely access across the world if you are an international medical graduate. It has 13 specialty programs. Two of the specialty programs, which is GP and secretary, its sole score will be applied. You don't need to have an interview. There is no interview stage, and other rest, which includes obs, gynae, surgery, ophthalmology, etc. There is an interview stage as well. So coming on to its format, it has two parts: professional dilemma and clinical problem solving. In the professional dilemma, if anybody has attempted Irish GP training exam, same format around, but number of questions are different. In professional dilemma, you have 50 questions and you have to attempt in 95 minutes. So under 2 minutes, you have to attempt this question, each question, and that is a technique, very important technique. Single most factor that can lead the success of this exam is time management. Now, what they will assess in professional dilemma, so they are going to test your knowledge around integrity, empathy, and pressure coping at work. So ethics basically at foundation level, at intern level. So basically this exam is designed for their interns. Now coming on to clinical problem solving, second part, it has 97 questions and 75 minutes. Under 1 minute you have to attempt each question, and make sure that you attempt all the questions, because there is no negative marking, and 10 to 15% question are pilot questions in both parts, which means they have no scoring, but you don't know which question is a pilot question. Now coming down, rounds, it is conducted 2 times in an year for 2 rounds. The major round is in for August intake 2025, which is next year, and there's a minor round, which is a round 2, is for February intake. So seats that are left over in the major rounds, so they are allocated in the round 2, which is in February. So now coming down, the booking, very simple. Make an account on Oriel, oriel.nhs.uk, and where you can access the training programs and application. You fill the application, and then after filling the application, if you're filling the eligibility criteria, they will send you an email and they will ask you to make an account on the Person VUE, which is a separate site where you can book the exam. This is the booking. So detailed videos are uploaded on my YouTube. Coming to the eligibility, very tricky and technical. So there's 2 different things you need to understand in eligibility. Number 1, what is eligibility to apply for exam, and what is eligibility when you start the training. So these 2 different things you need to understand. Even if you are in the process for GMC, you haven't applied GMC, if you are fully qualified to apply for GMC and you haven't applied yet, and you have an idea that you will get the GMC by August or even by February, because the score that you can move on for 2 rounds. So you should apply for this time. You're eligible. Anybody who has competencies of their foundation training and have a crest form, international medical graduate sign, becomes eligible to apply for exam, even they don't hold the GMC currently. Anybody who is doing MRCP, who is doing PLAB and is looking forward to have a GMC in a year, they are eligible to apply. They should have a house job, and they should have around 1 year experience post house job. Details of the videos have been uploaded on my YouTube. Now coming on to the eligibility when you start training. So when you start training program, which is August 2025 or the February 2026, so you should hold active GMC. That is the major criteria. You need to understand that. Coming on to the CREST form. CREST form is a special form specifically designed for international medical graduates who have not completed, who have not done internship foundation program in United Kingdom. So it is called Certificate of Readiness to Enter Specialty Training. So very simple form, 3 sections, but you need to fill this form carefully because any mistake or any error in this form might lead to rejection of your application. In UK Foundation program, there are 2 years. So in the same way, they have the competencies they design in this form that you need to fill all this. The detailed video has been uploaded by YouTube how to fill this form. Now coming on to the preparation. There are many resources that you can access, MCQ Bank, past tests, and also eMedica and others. So any one you can pick and choose and you can start preparing. But the important thing will be the exam technique that you need. I have attempted 2 times and I have gone on through one pool, which is past test. I haven't prepared, I'm telling you, to be honest, in a week or 2, but with a single technique, which is time management, I have passed 2 times and I have been allocated 2 times training slot. Now coming on to preparation time. So there's no time frame, 2 weeks, 3 weeks, 4 weeks, 6 weeks, as much preparation that you can do according to your circumstances. But you should prepare well for this exam because of a huge competition nowadays. Scoring, no pass and fail criteria, 1, 2, 3, 4 scoring, so which leads to very poor performance, below average performance, good performance, and very good performance. So based on that, you will be basically assessed according to the cohort, average performance of the cohort. So that's how it works. So anyone who is having 3 or 4 or even below average usually get, but I'm not sure about this time or last time. It was very competitive. Now coming on to the exam techniques, very important. I'll take some time on that. Exam technique is important in that I discuss the format of this. So professional dilemma question, 50 question in 95 minutes, and it has 2 different types of question in that, ranking and also best multiple choice, best 3 around different options you have to choose. So you can see a lot of videos on that yourself as well, and also on the site, official site. Now professional dilemma question, under 2 minutes you have to attempt one question, which is 114 second. Very long stems, very long options, like lengthy options, more than 5 options, 6 options, you need to rank. So first portion of the professional dilemma question, you need to be very careful. It will waste your time. So move on, practice a lot, but make sure that whatever comes in your mind, you have prepared very well. Just pick it and move on, because you need to make sure that you secure some time for easy question of part 1, which is professional dilemma, second portion. So second portion is best of 3 question in professional dilemma. You need to secure time for that, because these are the easy questions that you can pick. And make sure that you don't spend a lot of time on ranking the order professional dilemma questions. Please keep in mind. And this is the single most important factor that leads you success. No negative marking. Coming to the clinical problem solving question, same thing, 97 questions, 75 minutes, under 1 minute you need to attempt one question. I'm telling you, it's very important. So the different categories of question in that as well. So multiple choice questions, extended matching questions, and best of 1 question. So different questions that you can see on the site. In this, so first portion of the clinical problem solving question will be very short stem, and you feel it's very easy, you will be relaxed, but you need to keep in mind that the last portion of clinical problem solving will be having a long stems. 2 times I've attempted. I'm telling you with my experience that you become relaxed on the first portion of clinical problem solving questions, and then you don't have enough time for the last portion of clinical problem solving, because last portion having a long stems, and you even need a lot of time to read through the information and coming on to that answers. So be careful, save your time. Single most important factor that leads to success in my knowledge is time management. No negative marking, and you can attempt exam many times as you can in future. I'm not sure if the policy changes, but till now you can attempt, and there is no attempt limits for this exam. Best of luck. If you are eligible for GMC, you are holding GMC, my colleagues in Ireland, my colleagues in Pakistan especially, go for this exam. There are 6 centers in Pakistan and there are centers in Ireland as well, and you need to pick up early the slots, and detailed guides is on my YouTube channel. And best of luck for this opportunity. Thank you.